Hey, Mary Barbera, thanks for joining me today. How are you doing?
Great. Thanks for having me here.
Oh man, this is a treat because I can't tell you how many times I have lent out the verbal behavior approach to never have gotten them back. So I think personally I've purchased at least, I don't know, 4 to 6 copies of them. And so to be talking to you here is again a real treat. So thanks for joining us today.
Oh, it's been great to have met you online, and I look forward to hopefully meeting you in person sometime.
Yeah, for sure, for sure. And so I'm familiar with your story. I know many of our listeners are, but I want to kind of, for those who aren't, I want to kind of take it back to the beginning because I know we were talking about other podcast episodes I've done, as you've probably figured out by now. My typical first question is asking people how they got into behavior analysis. Your story is obviously unique, so would you mind taking a few minutes and sharing that with the audience?
Not at all, not at all. So I graduated with a bachelor's in science and nursing degree in the mid-'80s, and then I worked as a staff nurse in a neurology floor. And then I received my master's in science in nursing administration from the University of Penn. And I went on to become a head nurse, nurse manager of a floor, and went on to publish and do a little research in the nursing field. And my areas of interest were always, because I was in nursing administration, things like retention, time management, and the most recent study and publication I did was on shift-to-shift report. So you'd have nurses going from 7 to 3, and then the second shift would come in 3 to 11, and then the night shift would come in. And it just seemed that during those shift switches, there was a lot of wasted time, a lot of overtime, and a lot of patient falls and patient complaints because they weren't attended to. Because back in the 90s, early 90s, we were tape recording our reports. It was just a whole lot of, I described it as a bad game of pass it down the alley. So without knowing what ABA was at all, I recorded and transcribed what people were saying, what nurses were saying to each other during shift-to-shift report. And then I highlighted what should be on the Cardex and highlighted in a different color, what should be in the Cardex and what should be in the documents, and realized that 95% of what they were saying should have been written down. And we moved to a silent report system and proved that overtime went down and falls went down and documentation was improved. So I really thought that after I had my children that I would go back and get a PhD in nursing and continue my work in studying things like shift-to-shift report.
Well,
because it eventually went hospital-wide, this new silent report system that I developed basically by thinking this just doesn't make sense.
Mm-hmm.
So I was kind of always interested in behavior change and managing people and programs and things like that. So then I married Charles, my husband now, and he was a resident, an emergency medicine resident. We ended up moving back to Berks County, Pennsylvania, where I grew up. And I was 9 months pregnant with Lucas. So I had Lucas, and then 18 months later, I had Spencer. And things started to unravel with Lucas's behavior. In looking back, it actually started to unravel closer to 15 months, but I was pregnant with Spencer and not really noticing. So my husband first mentioned the possibility that Lucas might have autism in early 98, right after Spencer was born. I actually took Spencer to a well visit, and Charlie told me, hey, ask the doctor how many words Lucas should have. So I did. So he said about 25 words. And my husband was concerned because Lucas was just like not understanding about the baby and, just clueless, just not aware of what was happening. And so the doctor said 25 words. So I came home and he said he needed 25 words. And so Charlie's like, so he didn't think he had autism. And that was the first, I'm like looking at him, staring at him going, what are you talking about? He doesn't have autism. And I told him, which is this in the first page of my book, The Verbal Behavior Approach, I told Charlie, I never want to hear the word autism again. It was kind of very ironic, right?
Oh, for sure. Yeah. No, can I ask you a question real quick?
Go ahead. Uh-huh.
It seems like even from just kind of placing this in the chronological context back in the 90s, the autism really was not on the radar screen as it is today. And I just wanted to kind of observe that it was remarkable that your husband kind of had that in inkling back then. And, anyone who practices in the field for some period of time, can tell so many stories about doctors missing signs and telling people to relax and doing all those things that we know is not a good idea. And here your husband is not even a pediatrician. He's an emergency room doc.
Right.
I just want that's pretty cool.
Yeah. And he was, it was ironic too, because I ended up the one in denial for the first year. After he mentioned the word autism, I was the one in denial. And I was counting, this is another not funny story, but I was counting those 25 words. Like Lucas had delayed echolalia, which I didn't even know what that was. But we would go to the park, to the museum where they'd have ducks there. And they'd have a sign, please do not feed the ducks. So we would take Lucas to the museum, and he'd want to do these ritualistic things like, please do not feed the ducks. And then in the middle of the night, he'd go, please do not feed the duck, quack, quack, and so I'm counting, please do not feed the ducks, quack, quack, as 8 of his 25 words. I mean, literally.
Almost getting close. Yeah.
Yeah. And then, E-I-E-I-O, there's another 5 words, just crazy, because as a parent, you don't want something to be wrong with your child, so you'd hold on to these glimpses of words that would pop out, or little sing-songy things that he used to do, and maybe it's just a phase. And so there was just a lot of denial. And when Lucas was diagnosed, it was 1 in 500. And it was getting out there though, because, he was diagnosed in 99. My husband first mentioned in 98, but Let Me Hear Your Voice was published in 93. And Behavioral Intervention for Young Children with Autism, I believe, is 96. So they were out. And once I read those books, I actually read them right before he was diagnosed with moderate to severe autism. The other thing is, my husband and I thought, well, if he gets diagnosed, it's going to be very mild. I mean, he was enrolled in 2-year-old preschool. He went there without a shadow. It wasn't like he was completely, out of control. He was just like a quiet, kind of in his own world and getting speech therapy. So, a lot of people, including the pediatrician, wait and see. He's just a boy. Maybe he'll, grow out of it. And I didn't know at that point the early warning signs, which a big early warning sign is lack of pointing with your index finger. And so then I went on, once I found out that he had autism, I went on to work with Nancy Weissman of First Signs, and we went around the whole state in Pennsylvania to educate physicians on the earliest warning signs of autism. So I used my nursing background a lot, and we, both being medical background, we started reading, Let Me Hear Your Voice and behavioral intervention, and figured out that ABA was the way to go, and had to actually advocate and fight pretty seriously. At the time, we went to due process early on when he was just 3 years old, and we started with low-VOS type ABA therapy. That was pretty much the main game in town. And at the time, Pennsylvania was a state that has always been you were able to access almost 40 hours of therapy since he's been 3 years old. And we got it started about 3 months after his diagnosis. So he's gotten the best of the best treatment. We switched to a verbal behavior approach about a year into therapy in about 2000. And my first lawyer, actually, after I testified in my due process case, I testified for about 5 hours.
Oh my gosh.
And, I have a master's in nursing. I did little in-services for the preschool and, founded the Autism Society of Berks County. And so I get off the stand and he goes, "You should become a board certified behavior analyst." And I looked at him. I'm like, "Okay, what's that?" And he told me, "Oh, it's a new certification that just came out recently. And, you could take a distance learning program through Penn State," which is what I did. And back in the day, the newer BCBAs, they take online programs and it's all online. So this was a distance learning program, which was great because I was not in a position to be traveling anywhere, and I already had a big background. My master's in nursing administration was very much OBM-ish, as you can imagine. But we got a box of VHS tapes and binders of PowerPoint printouts. And so I would sit there and watch the tapes of people at Penn State. And so it ended up to be a really great program for me. And I know a lot of behavior analysts, are a little skeptical of, can you really learn online? I'm a true believer that you can totally learn online.
Yeah, I think there's a lot of different avenues, and there's probably pros and cons to all the different ways in which you can learn about behavior analysis. But for the moment, I want to hit the rewind button for a second. And you said you started with low-VOS therapy and then transitioned to a verbal behavior format. But just more broadly speaking, as a parent, not knowing what ABA is or not, and I know it sounds like you educated yourself by reading and stuff like that, but when someone came in and started working with your son using a behavior analytic format, what were your first impressions from a parent's perspective, not necessarily from a practitioner's one? I don't know if you still have that point if you can place yourself in that context.
Well, and I work with a lot of new families with new diagnoses, but for me, I was thrilled that somebody was going to come in with some expertise. There was different people. Oh, you don't need there weren't behavior analysts back then. These were low-VOS trained consultants, low-VOS replication site. So she would come down from Pittsburgh. I think she only came once a month, but the first time she came for 3 days. Mm-hmm. And I remember, sitting in the living room with my husband. My parents came. Somebody watched Lucas for half a day, and then he was in the room. And all three therapists were there. So it was a big, workshop type thing. And she was explaining. I mean, to me, it made a lot of sense because I already had my master's in nursing administration, and I was interested in research, and I was interested in formats. So it made a lot of sense. I remember we were saying, "Lucas, come here. Lucas, touch your nose. Lucas." And she goes, "Okay, everybody stop saying Lucas. He's the only child here. And it's just adding to his, language comprehension issues. You're more likely to say the child's name when you say no." And so she said, "Just stop using his name." Mm-hmm. And so I wrote a blog on that. That's a page in my book about not overusing the child's name. So, I learned lessons from day one, and it was great. She was an amazing consultant. And she was low-VOS trained, but she was also, I think she had her master's in preschool, preschool education. She was great. Mm-hmm. And one of the reasons we switched to a verbal behavior approach was because she moved south. And so we were going to get a brand new consultant anyway. And one of my really good friends, my autism friends, flew down to Florida at the same time to hear Dr. Vince Carbone speak down there. She came back. We had shared some of the same therapists with our two boys, and she said, "Mary, we got to switch." this is unbelievable. We bought the ABLEs. We tried to figure it out. We hired, instead of hiring another Lovaas consultant, we hired a VB consultant, which at the time was a little iffy. I mean, obviously in 2000, when the ABLEs just coming out in 1998, nobody really knew what they were doing. Mm-hmm. Yeah. So, but we learned, we figured it out.
I see. And so you go from there, and then, you have this recommendation from the attorney to become a BCBA, and you go ahead and do that. And so take me from there to authoring the verbal behavior approach. What were the circumstances under which that led you to think, you know what, I should probably write a book?
Yeah. So I became a behavior analyst in 2003, and right away I was recruited. I got an email from someone saying, hey, we want you to work for the Verbal Behavior Project of Pennsylvania, which was a statewide initiative that in 2002 they played around with 2 classrooms through it. I think it was like an $80,000 grant, and from the Department of Education. And they said, you're being considered for a position. I'm like, I was just trying to get Lucas to have a decent kindergarten experience, because he was getting ready to go to kindergarten. And so I was networking with other parents through the VB project. And I was saying, hey, I know how to do the ABLEs, kind of, sort of. And I'm a BCBA, or I'm getting ready to sit for BCBA. I wasn't a BCBA yet. And so then somebody said, well, okay, she seems like she might be good. So I wasn't really planning on going back to work, but then I thought, all right, well, I'll go back to work. So I started working for the Verbal Behavior Project, and but I was still doing those like first signs trainings for pediatricians, and so I was getting trained in just on my own. I went to an ADOS training to try to get myself better skills. And then I went to this STAT training, screening tool for autism in toddlers, by Wendy Stone. And it was down in Nashville. I think she moved since then. But the STAT is kind of a mini ADOS, and it can be done in non-clinical settings. So you don't need like a sterile room with a $1,500 kit. You can kind of, well, at least at the time, you could make your own kit, and you could do it in homes and, on floors with lots of distractors around. So I got trained in that. And one of the things I had to do to get certified in the STAT was I had to take videos of a typical kid and a kid with delays that was 2 years old. So somebody at the time referred me to a family that had a 2-year-old that was probably going to get a diagnosis. And so they came over to my house, and we'll just say the child's name was Tommy. So the child came to the house, and he was very delayed. He scored a 4 out of 4 on the STAT, which is the worst score. I also showed Mom how to do I did the enables real quick. He hardly had any skills. Showed her after the STAT, I showed her some manding techniques, and she was on the edge of her seat. She's like, oh my God, she was a nurse too. And she said, I need to, what can I read? What can I do? I need to learn all this stuff. Well, I didn't have, hours and hours to give her. And then I started recommending the books, like Let Me Hear a Voice, and Potty Training in a Day. And, not that she was into potty training, but some of the older books that had been really my Bibles.
Sure.
And then I realized, I'm like, yeah, but I wouldn't do half the stuff in Let Me Hear a Voice, because I had switched to a verbal behavior approach, right? And I was working with hundreds of kids in the Verbal Behavior Project. And so it was way different. It's a very different philosophy. So I started saying, oh man, I want you to read this, but I don't want you to do it like that, or he'll be a mess. And I didn't have the time to help her. So I said, you know what, we're doing a Verbal Behavior Project training next week in Harrisburg. And even though you're not school age, I can get you a seat in the beginner training. It's 2 days. You'd have to get a babysitter. You'd have to drive to Harrisburg. She's like, I'm doing it. So she went, and she learned for 2 days. And then I didn't hear from her. I saw her at the training. she came home, and I sent in my tape to get certified in the stat, and 4 months went by, and I heard from Wendy Stone or one of her people, and they said, you need to redo the stat tape because Happy Birthday is on the balloon, and the balloons have to be plain. Like, what?
Are you kidding me?
You can't even make this stuff up, right?
Oh,
so
my goodness.
Oh my gosh, I can't believe it, So I thought, well, I wanted to see how little Tommy was doing anyway. So I called up Mom, and I start out with, how's Tommy? And she's like, great. She goes, oh my God, that workshop was just incredible. She said, I came back within 2 or 4 days. He was talking. I mean, I just learned so much there that, I was able to implement it. He's talking. He's doing so much better. So I said, oh, well, great. It was awesome. And I said, can you bring him back so I can do another stat because Happy Birthday was on the balloons. So she brought him back, and he had scored, remember, 4 months prior, he had scored a 4 out of 4, which is the worst score.
Right.
And the cutoff for autism is 2 or greater on the score. And I think when she brought him back 4 months later, I think he only scored a 0.75 or a 1. Like, he had done that well to totally change his stat score. And he no longer on that met the criteria for autism. He got a diagnosis of autism or PDD-NOS, but he's one of these kids that did really well.
He just flew with it. Nice.
And I'm not really sure where he's at today, or but the last I ran into them, he was doing really well, like included or almost included with everything. And I don't know exactly where he was at, but he ended up doing really well. So then at that point, I thought, you know what, I got to write this down. I had all of this knowledge in my head that I had gotten from going to the Carbone Clinic, listening to Mark Sundberg for, days of trainings, working with hundreds of kids through the Verbal Behavior Project, learning myself how to do sign, how to transfer trials, just a bunch of different things. I also went on to publish an article with Rick Cabina, who was my BCBA mentor, called Using Transfer Procedures to Teach a Child Tax. And that was my son, Lucas. And it ended up to be a great study, which is available on my website. So I was doing a lot of work with transfer trials, a lot of work with just all kinds of different things. So we had done an article in a local newspaper too when Lucas was 4 or 5, and when that reporter came, it was a great article. She did like a 7-part series or something. It was a big article, and she told me, her name's Tracy Rasmussen, and she told me, if you ever want to write a book, I will help you. And so I contacted Tracy, and she helped me write my book.
Oh man, what a remarkable story. You're probably, I think almost everyone I've interviewed thus far has either written a book or, published several articles and things like that. And one of the things I've been meaning to ask folks is what their writing process is. And so with respect to this book, which is, obviously less academically focused and more so pointed at practitioners and parents and things like that. What did you have a specific process for writing the book?
Yes, I used Dragon Dictation.
Oh, really?
Yeah.
Okay.
I used Dragon Naturally Speaking because I wrote my book 10 years ago in 2006. And I was just at the Penn State Conference, and I ran into Mark Sundberg, of course. And we took our 10-year anniversary picture because 10 years ago, in August in 2006, I happened to be sitting next to him at the Penn State Conference at the Nittany Lion Inn, and I told him I was writing a book, and he started saying, oh, wow. And I knew him a little bit from the Verbal Behavior Project, and so he started manding for information. Hey, what's the book about? I'm like, okay, he's manding for information back. So I'm like, oh, it's called the Verbal Behavior. Well, I don't even know if I had a title then. It's about verbal behavior. And then he said, oh, wow, how much of your parent perspective versus how much of your professional, so then I was just like, hey, maybe you could, I'm really having, at the time, 10 years ago, I was really having trouble with the history of VB and comparing it to discrete trial Lovaas type therapy, because I didn't want to take credit for any of these, any of the work that obviously was done before me, and I was just pretty much the reporter, the translator of this information, not the creator of it. And so I was really struggling with that. I said, maybe you could read the book or read what I have or whatever. And he's like, yeah. And I'm like, hey, if you like it, you can endorse it. Yeah. And then I'm like, hey, maybe you would even write the foreword. And he's like, yeah. And I'm like, oh my God. I just can't believe I just asked them to write the foreword. So I, get home and I'm all excited. So I email him and it's so great to see you. Thanks for agreeing to read it, and you write the foreword. My deadline, this is August, and I said my deadline is September 30th to have like the whole book done.
Oh my gosh.
I don't know if your foreword, So he writes right back and he goes, oh my gosh, Mary, I had no idea this is what your time frame was like. You know what I mean? Because he was working on his VB map book, and he was also going on a 2-week vacation and leaving the next day. And then when he got back, he was going to Australia and writing his VB map book. So he goes, there's no way I can write the foreword or do anything for you. I'm so sorry. Right. So I'm not going to give it up without the college try. So I write right back and I said, okay, you don't have to do any of it. Just, I really need help with this, with the history and the comparison to the discrete trial. Because, that is critical. I don't want to, anger the other camps in ABA, and I don't want to, take credit for something or report the history as being wrong, which it was pretty much wrong. So he said, okay, if you send me what you have right now, and I had half the book drafted, not in perfect shape, half the book. If you send it to me tonight, I will print it out and I'll read it on the plane tomorrow, and I will give you general remarks when I get back at the end of August. So I'm like pushing send. I'm thinking, okay, I'm sending him chapters on non-vocal to vocal and manding. I'm the history. I'm like, oh my gosh, hopefully he doesn't think I'm a complete idiot. Mm-hmm. And then 2 weeks later, when he got back, it was actually my mom's birthday because I remember the date, August 22nd. He emailed me and he said, I love the book with capital love, and I want to write the foreword. And I was like screaming in my chair. I was so excited. So, I was thrilled.
Wow. What a story. Yeah. It's amazing.
I got a lot of stories, man.
Stories are memorable. So that's good.
Yeah.
So in terms of like the process, obviously timelines notwithstanding, the actual day-to-day process of writing the book, if you were to do a different book or another book, would you do it differently? Would you write it kind of the same way, using the same practices that you did with the first one?
I wrote a little ebook that's called More Talking, Less Tantrums, 10 Key Components Needed for Autism Treatment Regardless of Age, Ability, or Setting. Mm-hmm. And that was a webinar I did that was transcribed. So that turned into a little ebook. So I do think that talking out a book, whether it's dictation or from a webinar or is the way that I find best to get started of something that monumental. I mean, it was really helpful having Tracy help me write it because she would take my words and then she had 2 young kids that they were twins and they were typically developing, but they were like 3. I think they may have had a little speech delays or something. So I would she came over once, I think, with the twins. And so I showed her how to, break up a cookie into 10 pieces and how to do a man session, just so she could get a feel for it.
Mm-hmm.
So if she couldn't explain it in lay people's terms, if I'd say something that she didn't understand, then she'd have to clarify with me, and then she would write it in a more layman's terms. So I'm already speaking pretty in layman's terms, and then she took it and made it even more understandable. And she just has a great writing style. Like I said for chapter 12, my last chapter, I don't even know how she's going to mash this together. You know what I mean? It was just kind of random thoughts and soapboxes. And when I got chapter 12 back, and after she got at it, it was very touching. I even cried, which I'm not a big crier. So, I mean, I was very happy with the way she worked so well with me.
Well, that's awesome. I've heard the term the curse of information, and certainly we as behavior analysts oftentimes have that curse of information where we have a large body of knowledge on a particular topic area. And the way I've heard it described is that, our knowledge is at a 10, and we oftentimes, in trying to communicate with lay people, dial it back to like 5 or 6. But we really need to go back to like 2 or 3, on a 10-point scale. And it sounds like your Tracy was able to, take the material and bring it back to a level where it would be received well by all readers. So,
right. But at the same time, people that you've interviewed before really are at a much higher level than I am in terms of applied behavior analysis. Like, I feel that I've always been a relatively newbie to the field, and I think because of my nursing background, have always kind of brought things down for families to understand. A doctor might come in and say, oh, you have glioblastoma, blah, blah, blah. And then they leave, and the parents,
they'd be looking at you saying, can you translate that, please?
What did he say? And so I think, all along I've always been and I came in as a parent, so yeah. I'm thinking, so I don't know that my knowledge is up at a 10, but, I only have so much time on this earth. So I'm I equate myself with, we're on a big mountain. We've got a lot of people to help get up the mountain, and I am not at the top of the mountain by any stretch of the imagination. I'm kind of like quarter way up, halfway up. And if I can get people just started and just comfortable getting moving, my goal isn't to fine tune things that I'm this major researcher, and, because it, as you know, takes a lot of time to publish in a peer-reviewed journal. And I feel like I have more of a gift at the lower level of trying to get just basic practical tips out.
Well, I would say a different level than a lower level, just because I know you are reaching a lot of people, and
right.
It's making a difference. And I guess as a
less analytical, high, especially the way I think very analytically, but I speak not as analytically as most people.
Mm-hmm. So let's. I know you have a course that you've been. You've already you developed and launched, and to further get the information out there about using verbal behavioral strategies with kids on the spectrum.
Yeah.
So, kind of a similar question to what I asked earlier. What were the circumstances that led you to think about creating a course?
Right. That's a great question. I have been thinking and trying and wondering how to do it for about 5 years as online programs started. I don't love to travel. I have been to Australia twice to present on autism. I've been to France and Germany to present, Canada, Canada, and many, many parts of the United States. In fact, from 2004 till 2014, I presented every year at the ABA conference. I also was asked to do, 2-day workshops and keynotes all over the country and several parts of the world. And I mean, that's great. And I do that. I just don't do it a ton because I'm very busy. I have, 2 sons. Now, Lucas just turned 20 and Spencer is 18. Spencer's going off to college this fall. So, our dynamics here, if I go traveling for 5 days, I have to get coverage for Lucas. So it gets complicated. Mm-hmm. My geography and history skills are lacking too. So I don't like to go to foreign countries internationally by myself. It's kind of scary. So I don't love to travel. And even if I'm there, and I am happy to be there when I am there, I'm presenting to 60, 100, 300 people, whatever. It's a lot of information. If I speak for 2 days, it's a lot of information, and it's only to the set amount of people that are there. And then they go home and they try to implement this, and Johnny's on the floor, and well, I didn't show a video of Johnny on the floor when you did that. Mm-hmm. I wonder how to do that. And so I feel like I'm giving them too much information in a condensed format. It's just, and then people are, when I went to present in the UK last year, some woman flew in from Pakistan, some woman flew in from Spain. It's a lot of money for these people. It's a lot of money to pay me, and it's a lot of travel time. And so I believe that it's just much more efficient for everyone to learn online.
Okay.
And so I started in 2015. I launched a program called Autism ABA Help, online training for professionals and Gung-Ho parents. And I thought maybe Gung-Ho was too cutesy, but I always used to call myself the Gung-Ho parent because I'd be like in the front, at a conference or going to every I went to so many conferences about so many different areas of autism. Definitely am not a one camp kind of gal. If I can go to another type of, camp and learn something that I can help Lucas or others, I'll go. Mm-hmm. So I decided to look up Gung-Ho, and it's something like enthusiastically eager, especially in the times of warfare. So I'm like, that fits parents. Because you don't have to be an expert parent. We've had parents take the course that have no idea what ABA is. And then we've had seasoned BCBAs take my online program who are like, literally one guy said, course has changed my life as a behavior analyst.
Wow.
From a seasoned BCBA. And many seasoned BCBAs maintain ongoing membership because they like the camaraderie of our Facebook group. They like to use the online training lessons to train their staff, to train their families. So it's becoming quite a very exciting endeavor. So we've had people purchase the program for from 40 different countries now. We've only launched 5 times. Only sold the program to a few hundred people, not anywhere near 500 or 1,000, but from 40 different countries. It's amazing to see, because really, if we think about like how limited the information is, especially to people in other countries, it's they can't get to see someone present. And I found that people are really able to follow the program and implement. I have exercises, homework that are optional, but just one of the examples is for homework. After the first getting started unit is, your child or client is there, and you want to, for an hour, write down all the things they say, if anything. If they don't talk, if they don't speak at all, if they say any sounds, I want you to write those down. And then we do the same activity after Unit 4. And the first time I ran the program, it was dripped out, which means you got Unit 1, and then the next week you got Unit 2, and the next week you got Unit 3. And so it was a 5-week course. And so one of the very new parents just got the diagnosis. She took the course, and she said in 5 weeks her son's language doubled. And she knew that because we took data.
I see.
Yeah.
It's funny how that works.
And it was very empowering for people. I offer a 14-day money-back guarantee. I think I've had 3 returns.
Wow, that's remarkable. And people can find this at marybarbera.com. Is that I know you've got a couple of different websites, but is that the main?
No, that's my website, marybarbera.com. You can do a /AAH, and we are going to give a $50 off for your podcast listeners.
Oh,
and
cool.
They can type in the coupon code. You can put this in the show notes too, but the coupon code, they would type in behavior, the English spelling, the United States spelling, behavior pod, P-O-D.
Okay.
All one word, all caps. And that should bring you down $50 off. Make sure your $50 off comes off before you purchase. And if there's any problem, you can just contact me through my website. So I hope that your listeners will consider joining us. We've had, out of the about 300 people that have purchased so far, we've had about 40% behavior analysts, 40% parents, 10% speech pathologists, and 10% teachers or tutors. And then the ongoing membership is about 60% behavior analysts. So we're creating quite a little tribe.
I was going to use that word, actually.
Yes, it is definitely a very good tribe.
Have you had people taking your course and participating in your community while at the same time preparing, either through taking courses or through supervision, to sit for the exam?
I have had some students, not as many as you would think, though. Most of them are behavior analysts that are. Actually, there has been some, yes.
I see.
I can think of a few, but I thought there'd be more students, but I think students are probably overwhelmed with all the coursework they have. But
yeah, that makes sense.
Somebody just contacted me the other day, saying that she was pursuing her PhD and she would like to study whether my course relieves parent stress or something. So, I'm very open to working with people to see how this might work to help, as many people. We've talked about maybe making it an RBT training. Right now it's good for type 3 CEUs for BCBAs, but I'm hoping soon to make that into type 2 CEUs. So I think, and I'm also, which is really exciting, working, it's going to be done soon, this month, hopefully, intermediate learner program. So I'm taking all the stuff from the basic program, which is going to be a prerequisite for this intermediate learner program. So the intermediate learner program is going to cover all VB-MAP level 2 and 3 and beyond. So I'm going to show videos of how to teach prepositions and pronouns and interverbal webbing and all kinds of things, talking about how to, some kids repeat say. When you say banana, they'll say banana. How do you fix things like that?
Right.
And talking about the analysis of how intermediate learners can get really messed up with their language. So that's coming out. I have a beta testing group looking at those things now, and I'm hoping to offer it to graduates of the basic Autism ABA Help program starting this fall.
Oh, wow. That's very exciting. And I think it'll be interesting to see how your student demographic changes, or if it does, or do you still maintain that 40-40, 10-10 ratio?
Yeah.
With regard to the BCBAs who are in the program right now, is there a particular, I don't know, for lack of a better word, profile, or is the typical BCBA enrolled in your program as someone who maybe had a different focus in their graduate training? I'm just trying to think of, we have several. I can think of
of a few that are really traditionally LOVAS, discrete trial trained, and they're having families come to them wanting VB, and
Okay.
and so they're trying to see what that looks like. I've had lots of BCBAs that have seen me live or have read my book and handed it out like you have, Matt, and they want to learn more because, one of the things, and I don't know that I answered this, but why the online course versus just my book? Well, a lot of people, can read my book and read about the count and man procedure in chapter 2. And, but really, what does that look like? And it looks different for different kids, obviously. And, but I always struggled with, I think people are much more visual. I've had the fortune, after I left the Verbal Behavior Project, which is now the Patton, Pattan, Patton Autism ABA Initiative. They changed the name right after I left from the Pennsylvania Verbal Behavior Project. But after I left the project in 2010, I completed my PhD in leadership. And my dissertation is on how to train people on the verbal operants. My dissertation is actually available on my website as well. But after I left the project, I started working with early intervention kids, birth to 3. And so I was able then to formulate how to teach kids and how to train parents to teach kids and early intervention providers to in more of a step-by-step format. So I was able to develop my program. And then I've worked with the same handful of kids for the past about 3 or 4 years as I've developed them. And I have video permission for almost all of them. So that's been really great. Like I just attended a Penn State workshop, National Autism Conference at Penn State is every August. And there was this wonderful researcher from Italy, Francesca Del Espinosa, probably totally butchering her name. I'm sorry if I did. But I saw her present last year on autoclitic framing, and this year she presented on theory of mind, which I wasn't even going to go to because I thought the description sounded really high functioning, and I have a lot of more early intermediate learners, and I thought, but she was so good last year with autoclitic framing, and then I thought, you know what, I'm going to go, and it was unbelievable. Probably the best workshop I've been to in years.
Oh wow! It's always nice when it's sometimes we have a tendency to strike out sometimes when we make these choices of what to go see. So it's really fun when you get something that works and clicks with you, right?
Yeah, it was unbelievable. And she showed some awesome videos, and I had two or three clients in mind that I have video permission for that I literally was with one of my clients this morning, and we got some awesome videos of just what I learned at the conference. So, it's been, and I'll plan to show that within my online program, either as a bonus or as part of the intermediate course, if I can get myself together. It's just a lot of work to create these programs, and you don't want people to be jumping into these advanced programs before they have the basics down, for sure.
Yeah, absolutely. Well, on that note, do you have any, I was going to ask you about any tips for practitioners to keep, up to date on the research and things like that, either online or in person. It sounds like you had a great in-person, experience recently. But given that you are developing this kind of expertise in online learning and things like that, do you have any tips for practitioners keeping up to date with stuff? And again, you can take that either way, either in person or online.
Right. So a lot of my autism continuing education has been through going to the National Autism Conference, which I said is the first week of August every year at Penn State. And they usually have really great speakers like Mark Sundberg, Vince Carbone, Brian Awada. There were multiple people there that they give 3-hour workshops, and you can get your continuing education credits there. So it is a great conference. And you can also access a lot of these through webcasting. I'm not sure of the exact the National Autism Conference webcast, but I'm sure if you Googled that, you could find it, or maybe Matt, you could put it in the show notes. But I find that you can do it in person or online, but it's just seeing some of the videos that Francesca had was great. I also saw Brian Awada there, who I've seen him in years past, but I hadn't seen him for a few years, so I thought I'd go to see him, and that was really good. He presented on automatic reinforcement, and I was interested because my son Lucas is 20, and he has had multiple issues with problem behaviors, self-injurious behavior of knuckle biting and head hitting or aggression when he has a headache or when he's startled. And this started, back when he was about 14 or 15. And so, especially with my medical background, I maintain my nursing license. My husband is, of course, a physician still. And, so we're trying to figure out, like, he's biting his knuckle and he's saying head hurts. So Lucas can say enough for us to realize that it's a medical issue. And so as a behavior analyst, I get really concerned when people, when behavior analysts are like, oh, it's not medical, they ruled that out. I'm like looking at them like, how can you rule that out? When you go to a doctor, that doesn't mean you've ruled out all medical, especially if the child doesn't speak or have any way to tell you what the problem is. And so a few years ago, the doctor, the psychiatrist actually diagnosed Lucas with a autonomic nervous system problem, and that was causing him to have an abnormal startle response. So it's like that fight or flight response. And so when a startle happens, he actually goes very much in a flight situation or a fight situation, where, some people might, when they get really startled or stressed, they might pass out or go the other way, where he goes kind of a little overboard. So he's been on a medication for his startle response. But, now when I go to see kids, I'll do FBAs. And I did one fairly recently at a residential treatment facility on a 17-year-old. And, he has problem behaviors too. And I'm looking around, of course, all the kids there have major problem behaviors. And I just have to think, like, how much of this has a medical component. Mm-hmm. And I just think, and Brian Awada at his talk at Penn State said there's been no published research on automatic negative behavior. And so it kind of is shocking and disappointing, especially because I really do believe that there's a medical component in many, many instances that is either undiscovered or, there's just some issues.
Well, it reminds me of the conversation I had with Greg Hanley in our second interview when we were talking about the relationship between practice and science. And sometimes, science informs the practice, and sometimes, vice versa. Mm-hmm. So this might be one of those things where, you've seen a clinical effect with your son.
Right. And I totally a practice than science, because I've, done so much hands-on with Lucas trying to figure out things for him, like mm-hmm. how to teach him to blow his nose, for instance, how to teach him to tie his shoes. And then I would do blogs on this, and I would, there's YouTube videos. So I would really encourage students out there, or people looking for dissertation topics, or people looking for research topics, to go on marybarbera.com and check out my blogs, because I have a lot of procedures there and things that I feel pretty strongly about that I've done my own kind of research over the years. I mean, when we were in the Verbal Behavior Project, we actually had to do case studies where we'd have inter-observer agreement, we'd have designs, we'd have graphs. It's not published, but I, present it every year at the ABA conference. So just because it's not in a peer-reviewed journal or a double-blind study as a medicine does not mean that it might not work, and that all parents that believe in XYZ are crazy. For a specific child, like Lucas, for instance, when he was 6, he developed acute onset tics, like motor vocal tics, and they were just getting worse and worse. And I was a behavior analyst, and so I got out my clicker and started keeping tallies of trying to figure out how frequently this was happening. Was there, a behavioral function? What was the, antecedent? It was all over the place. It was worse and worse. And on a given day, it was 500 times a day. And it turned out to 1.39 a minute. I mean, that's how much it was happening. It was out of the blue. And so I started doing research on acute onset tics online on Google. And at the same time, he had kind of open lesions on his legs. It looked like he had mosquito bites, but, it was June. Nobody else had mosquito bites, and they almost looked infected. So I talked to my husband, and I said, let's put him on an antibiotic. And day 5 of the antibiotic, Lucas's tics went to 0 from 500, and his legs cleared up. So he either had a staph infection. So I started looking into PANDAS. I don't know if you've ever heard of that, but it's pediatric autoimmune neuropsychiatric disorder associated with strep. And you can find out more at pandasnetwork.com or .org. But
I'll find it and put it in the show notes.
They changed PANDAS to PANS now, because what they're finding is a lot of times it's not related to strep. It's related to staph or mycoplasma or some other bacterial infection. So now it's PANS, which is pediatric autoimmune neuropsychiatric syndrome. And it can cause acute onset or exacerbation of tics and or OCD. But a lot of people believe that, and he went on to get the actual diagnosis years later, but we treated him almost every time he got tics. We treated him with antibiotics, and he got better. And then the one time he still had a residual tics, 40 a day. So the pediatrician put him on a stronger antibiotic, and it kicked that out of him. But, do I have any peer-reviewed published data on that? No, but I can tell you, and I've seen other clients. I've seen clients that all of a sudden have acute changes in behavior with tics, and I tell the parents, go to the pediatrician, look at this website. They get on antibiotics, and sometimes antibiotics aren't enough. Sometimes kids need immunoglobulin therapy, steroids. I mean, but that's a whole medical thing. So behavior analysts are they'll try to treat it behaviorally, and they won't be able to.
Right, because they're not addressing the underpinnings.
Yeah. So I mean, I think with my background as a nurse and a behavior analyst, I would have the ability and the interest in trying to design some studies to publish some of this stuff. But at the same time, it's how many things can you get into? And so I really have to prioritize.
For sure.
But but to get it back to the online, how did I learn online how to do the online stuff, how to have a course and how to do marketing and all that. I've been taking several classes online. One of the things I started out with is a small book called The Millionaire Messenger, and by Brendan Bouchard. So readers may want to check that out. And then I follow Amy Porterfield's podcast on online marketing, and I'm actually going out to San Diego this weekend to see Amy Porterfield live, which she hardly ever is live. So I'm excited about that. So I've been trying to learn all about online marketing and trying to get my message out, as at the same time trying to learn new techniques for autism to help people around the world.
Wow, very cool. Well, you've given me a lot of homework here, Mary, for the show notes. So I've got a list of links to run down, and I'll make sure to have all that in there and more. I think we're probably about at our hour mark or so, and so I want to be respectful of your time. Is there anything else you want to leave with our audience?
No, it's been great getting to know you better through this podcast, and hopefully my multiple stories, will help inspire others. And I think ABA is a great field, and I'm excited that there's more things like this podcast and my online program to really try to get the message out, because I think we have a lot of research and a lot of knowledge, and now it's just disseminating that is just so key to help people.
Agreed. Well, thank you so much for your time. And again, folks in the audience, you can find everything you need to know that we talked about today at marybarbera.com. And don't forget, if you are interested in the course, there is that coupon Behavior Pod. And again, I'll put all that stuff in the show notes at behavioralobservations.com. So, Mary, thanks so much again for joining us today.
Thank you, Matt.
All right, take care.